Hello. Audible. Coming together is a beginning. Keeping together is progress, and working together is success. Good afternoon, everyone. My name is Gauri Murgant, and I am much delighted to offer a hearty welcome to everyone gathered here to this launch of Women's Cancer Prevention Clinic. I further take this privilege to welcome our dignitaries and distinguished guests of honor and management at Apollo Hospitals, Navi Mumbai. Keeping up with the demands of everyday life can result in a detrimental impact on a woman's health. And as a woman, it is essential that preventive care becomes an integral part of regular self-care and well-being regime. Apollo Hospitals has emerged rapidly as a center of excellence in various specialties and super specialties over the last few years and has been a pioneer in initiating many screening programs. Today, keeping up with the tradition, we are launching our Women's Cancer Prevention Clinic. A word of hearty welcome is the sweetest of all things, and I would like to invite Dr. Anita Bajaj, Consultant Radiology, Apollo Hospitals, to kindly open this program with a welcome address. Please, ma'am.
Thank you so much. It is my honor to welcome you all. This is a wonderful program. Nothing gives me pleasure. This is very close to my heart. Women's cancer prevention, because see, by here we see day to day in India the cancers, when the detection is grade 3, grade 4 cancers, and it pains us that what we could have done if we had detected early, especially the breast cancer, which is the leading cause. So I think this is a fantastic initiative to make the patients aware, to make the people aware. Come for screening, get yourself tested, and we have a fantastic team as we go through this. So nothing like this, and I would really encourage all the women, do a self-palpation, do a routine screening, come for ultrasounds. And early detection not only helps in early cure. The main thing, there's so much, the burden on the finances, on the family, so much lesser. You know, so just come, make yourself most important also, and come for regular screening, come for regular checkups. And the moment we detect anything which is a little bit also abnormal, things can, you know, the treatment is so much better when compared to when it has already become a lump or when the cancer has further progressed. So that's what I would say. Let's start with the session now. Thank you, everyone.
Thank you, ma'am, and definitely it's quite encouraging, and I'm sure more and more women would be part of our this clinic here. With this, I would like to invite Dr. Neeta Nair, Lead Consultant Breast Surgery, to give the introductory address.
Thank you, Gauri. For all of you who don't know, Gauri is our genetic counselor and excellent at it. So good afternoon, ladies and gentlemen, and thank you very much for being part of our endeavor. We thank you for all this support that you're giving us. Women's cancers, unfortunately, are associated with most of the reproductive organs, and with that, they come with a small social stigma. This has led to most of our patients coming in advanced stages because of a certain amount of perception of sexualization of these organs, and because of which they shy away from coming to the clinic early. You heard how Anita Madam spoke to us about how they come in advanced stages, and because of which we need them to come in early. Most cancers are painless at the outset, and pain is only a sign of advanced cancers. Be it a painless lump, be it painless discharge and pervaginal bleeding, we need to create awareness in society, and we need to have our women come in early. Understanding the signs and symptoms of cancers is what brings our women to the clinic for early detection. But before detection is the step of prevention and screening. This is what Apollo Hospital is taking forward with this step today. We bring you a women's cancer prevention clinic. This clinic is an endeavor by the women oncologists in this organization, where we are working together towards bringing benefit to society. It's Women for Women Cancers. So the women oncologists have put this together for you for women's cancers, and it's our step for better screening, early detection, and prevention. Just to give you a short overview, we're going to play a video for you to understand what we're working towards. Gauri, can you play the video? Just go to, yeah. This one. It's that one? Yeah. It should be a video, so 7th cut.
Breast cancer is
Sorry. While we wait for technology that's getting the better of us, I will tell you, you saw a photograph of 7 women standing there. Behind that are many more women that have worked together towards putting this together. I'm going to name a few. I may leave out some, and I'm sorry for that, but I'm extremely grateful for their support. We have Sarita Lawrence, who is our head of marketing. We have Akshata, who's also part of the medical services team. We have Dr. Sonal. We have Supriya, who's somewhere in the audience. And we have Stuti. The entire management team has come together, given us this opportunity, and they have worked towards putting this together for us. So that's a very small part of the bigger picture. And standing with us in solidarity, hidden behind the scenes, are all the men, some of whom you will see come up and speak to us, some of whom will silently stand behind us, for which we're very, very grateful.
breast cancer is unfortunately the most common cancer among women in India. Unlike in the West, 40% of women in India still present in advanced stages. Our first step towards cure is early detection. The Women's Cancer Prevention Clinic, which has been started at the Apollo Cancer Centers in Navi Mumbai, is the first step in that endeavor. We as women oncologists come together to treat women's cancers, and we implore you to come forward for early detection and better health.
Cervical cancer, which is one of the most important and common cancers affecting Indian women, is preventable with HPV vaccination and with pap smear screening. HPV vaccination is recommended for all young girls between 9 to 15 years of age, and it is the most important measure with the help of which we can prevent this important cancer. The other tool which is equally important for prevention as well as early detection of cervical cancer is pap smear screening and HPV testing, which is recommended for all women between 30 to 65 years of age at every 3-year interval.
Do you know, every 4 minutes, one woman is getting detected with breast cancer in India, and every 13th minute, a woman is dying of breast cancer? So what does the screening do? Screening means it can be detected even before it has actually formed a lump. So you go for an annual mammogram after the age of 40, which is mandatory. And this can be associated with ultrasound breast, MRI, and if required, if there is some lump detected, we can do a then and there a biopsy, which is just a 10-minute procedure.
The advancement in the treatment techniques like image-guided radiotherapy will help to reduce the treatment duration. That is called hypofractionation. So for early breast cancer, we can deliver radiotherapy treatment within 1 week or once in a week on weekend. Similarly, for gynecological cancers, the brachytherapy, that is also called internal radiation therapy, can deliver treatment more precisely and in a safer manner.
The risk factors include young age at first pregnancy, multiple pregnancies, multiple sexual partners, smoking, long-term use of oral contraceptives, and most importantly, HPV infection. The main symptom is abnormal vaginal bleeding, which can be bleeding after sex, after menopause, or outside the usual menstrual cycle of a woman. Pap smear is a simple screening test for the early diagnosis and thereby early treatment of cervical cancer.
Breast cancer is one of the commonly diagnosed cancer for women in cities. One can reduce the risk factors for breast cancer by taking a healthy diet, exercising and maintaining a good body weight, staying away from alcohol, reducing use of plastics in form of water bottles, and getting yourself screened from this cancer at regular intervals. A self-breast examination, mammography, SOS FNAC or a core-needle biopsy from the suspected lesion could help in diagnosing the cancer at an early stage.
Prevention of the disease, that is, if possible, and if not, then at least catching hold of cancer at its earliest is very much desirable, as it decreases the financial, the emotional and the physical burden on the patient and the entire family. As females, we tend to underplay our health issues. This should not be done, because the health of the women, they affect the health of the entire family.
To start the inaugural ceremony as well as lighting of the lamp, may I invite our chief guest for the day, Dr. Sangeeta Srivastava, who is the president of the IMA Navi Mumbai, Mr. Santosh Marathe, regional CEO, Apollo Hospitals Western Region, Dr. Rohini Sridhar, senior VP of Medical Services, Dr. Ravi Shankar, joint medical director of Apollo Hospitals Navi Mumbai. Can I also request all our oncologists of the Women's Cancer Prevention Clinic come up? We have Richa Bansal, Dr. Bali Borde, Dr. Shweta Harwani, Dr. Veena Vandre, Dr. Anita Bajaj and Dr. Smriti Jha. Also to help us with the lamp lighting and stand with us, we have Dr. Tejinder Singh and Dr. Sandeep De. Can we please have you join us up here? And Sonal Bindora.
नहीं आ जाइए और वुमेन पावर कम करता है प्लीज थैंक यू
I request all the dignitaries to please cut the ribbon and unveil our clinic. I would thank you all. I would request Dr. Sangeeta Srivastava, President IMA Navi Mumbai, to please say a few words, ma'am.
Good afternoon, everyone. कैसे हैं आप सभी? I am Dr. Sangeeta Srivastava, President IMA Navi Mumbai. अपोलो विमेन कैंसर प्रिवेंशन सेंटर के इस ओपनिंग समारोह में आप सभी को बहुत बहुत बधाई। मैं अपोलो के साथ बहुत लंबे समय से जुड़ी रही हूँ, पर आज आपने जो सम्मान और स्नेह मुझे दिया है उसके लिए मैं आप सभी का हृदय से धन्यवाद देती हूँ। जैसा कि आप सभी जानते हैं, प्रिवेंशन इज़ बेटर देन क्योर। सो अपोलो हॉस्पिटल की जो ये पहल है वो बहुत ही सराहनीय है, और मैं और हम सभी को वैसे तो पब्लिक में हेल्थ को लेकर बहुत ज़्यादा अवेयरनेस बढ़ी है, पर मेरी आप सभी से ये रिक्वेस्ट है मेनली अपोलो हॉस्पिटल से कि हमें स्कूल्स में, कॉलेजेस में और सोसाइटीज़ में पब्लिक अवेयरनेस प्रोग्राम्स करने चाहिए। और जैसा कि डॉक्टर अनीता ने बताया, इनिशियल स्क्रीनिंग कैंप्स करने चाहिए ताकि हम अधिक से अधिक केसेस जल्दी से जल्दी डिटेक्ट कर सकें और टाइमली सोसाइटी को भी हेल्प कर सकें। सो थैंक यू वेरी मच, एंड आप सभी को इतने अच्छे काम के लिए बहुत बहुत बधाई। थैंक यू।
Thank you, ma'am. Now I would like to invite someone under whose leadership and encouragement we all, have initiated all these programs. Mr. Santosh Marathe, sir, Regional CEO. Please, sir, if you could say a few words.
Good afternoon, ladies and gentlemen. Thank you, Dr. Sangeeta, for gracing the occasion. Women health has always been an area which is near to the heart of Apollo. And I think any program which can directly facilitate detecting this kind of cure treatment early on is an area of passion for us. And definitely there has been some wonderful work done by all the oncologist team. And it's a brilliant move to have all ladies team members across, not only from the medical oncology team, the overall breast oncology team, but also from lab and medical imaging. I think we are privileged to have some of the fine clinicians which are working full-time at Apollo. So at Apollo, obviously, oncology, we have done a lot of initiatives to undertake screening program. And historically, we have always seen that early detection always has a good impact on the recouping time, quality of life, and more importantly, it also brings the cost of care down significantly. Screening is an area of focus. Apart from this initiative, which is getting launched today, we'll be investing a lot of time and effort in undertaking screening in the community. And to mobilize that, we are also getting a mobile van, which will be available door to door in corporates and community to take this approach beyond the campus. So this is something which we are eager and assure that this kind of initiatives will definitely go a long way in detecting cancer early on in terms of providing a good quality of life. And it's a great initiative. Congratulations to the team who have put across such a wonderful clinical program across together, and looking forward to this being availed by most of the ladies in town. Thank you.
Thank you, sir. I would now like to invite Dr. Rohini Sridhar, Senior Vice President, Medical Operations, Apollo Groups.
Good afternoon. It's an absolute delight for me to be here today. I'm very fortunate that my visit to Navi Mumbai coincided with the launch of the Apollo Women's Cancer Prevention Clinic. Apollo has been in the forefront of doing a lot of stuff in oncology. We're one of the largest oncology care providers in the country, but we haven't done this. So it goes to show that in Navi Mumbai, which is a jewel in the Apollo crown, I think woman power is palpable. You felt it when you walked into the room, and I think you can feel it as you walk across the hospital. So it's a brilliant, brilliant initiative, and need to thank Neeta, Anita, Richa Bansal, and all of you who put it together. Thank you for thinking about this. You made us think about it, and when we look at the success of this program, maybe we'll think of taking it across the country. So I'd just like to share a couple of facts with you. Apollo, as you know, is a very tech-enabled hospital. We have all sorts of tech across our 73 hospitals. And if you look at mammogram, it is the one tech tool that we have that is the least utilized. This is a question we need to ask ourselves and really introspect we have a large women's workforce even within the organization. And I'm almost scared to ask the question, have all of us had our mammogram? I'm thank Dr. Sangeeta for nodding so vehemently, but there are several people behind you and on either side of you who I don't know are not answering with that degree of confidence. So my message here today is, we know that, as the video so brilliantly said, it's better to prevent cancer. And in order to do that, we need to make sure that we take the steps in the right direction. We all know that when the health checks are done, for some reason or the other, the pap smear gets left out or the mammogram doesn't get done. So I have one request today for every woman in the room. Each one, please reach one. So each one of you, please do what it takes, whether it is vaccinating your daughter or bringing your mom for a mammogram, and please reach out to at least one person today. And please tell them to take at least one step in the direction of preventing cancer. And I think if we manage to do that, I think this will be the foundation stone for a very successful clinic. So with this, I'd like to wish the team of the Women's Cancer Prevention Clinic all the best. I'm sure you're going to be a great success, and we look to you to learn and grow this across the country. Thank you.
Thank you, ma'am, and thank you all the dignitaries for such encouraging words. With this, let's start our program. And I would like to invite Dr. Neeta Nair, Lead Consultant Breast Surgery. Dr. Nair has been a cancer surgeon with over 20 years of experience, and she has been a consultant in breast surgery disease management group with the Tata Memorial Hospital as well. Ma'am will be talking about breast cancer current screening recommendations.
So thank you, everyone. Just to reiterate the way the clinic works and how we will be hoping to move forward, just as Rohini Madam suggested, what all your goodie bags will have is a small booklet on breast cancer, self-breast examination. All of it is to just empower you yourself to be able to take this forward. Yeah. So this is just to give you a brief overview and understanding of screening and management of early breast cancers, to understand what we want to take further. The first step towards anything is knowledge, and in understanding what are the signs and symptoms of breast cancer is how we can empower ourselves and come in for early screening. Picking up a breast lump, which, like we said earlier also, which is painless, or an axillary lump, nipple discharge or skin retraction, changes in the skin in terms of discoloration, puckering, or PDO are concerns that we want women to pick up by doing self-breast examination monthly. You don't want them to present with signs of distant disease and advanced disease, because early detection is our step towards cure for breast cancer. We cannot prevent it, but we can pick it up early. The incidence of breast cancer is increasing in India. It's as high as 1 in 22 women in urban India. It may not be as high as that we see in the West, which is 1 in 8, but our concern, which you heard Dr. Anita talk to you about earlier also, is that 40% of our women still present with advanced cancer. And that is the reason that more women in India die of breast cancer than in the West, because our women present with later or more advanced stages. Should we look at everyone and who should be come in for screening? The idea is understand what are your risk factors. There are non-modifiable risk factors like age, being a woman, certain length of reproductive life, or family history. We can't change those, but we can impact what are the modifiable factors. First of which is having your first child before the age of 30, breastfeeding your child for at least a year, and of course the risk associated with obesity and increase in body weight. Exercise is the one step that we can take towards better health for cancer as well as other non-communicable diseases. Hereditary cancers are only about 5 to 10% of breast cancers that present to us. If these are women with either known mutations or family histories of breast cancer, we would talk to them about a very different set of screening guidelines because it's more intensive in its approach. We use more MRI, we use them more often. For the routine population, our efforts are towards screening related to the 1 in 22 risk that we know of. So the first step that women can take for themselves is self-breast examination, which is done once a month. And you understand, we've given you, like I said, the booklets that tell you how to do it. You evaluate the skin, the parenchyma, the underarms, as well as the neck nodes. The second, of course, is a good clinical examination. So breast self-examination, like I said, monthly. And what the peril of breast self-examination is that women start doing it. So after today's talk, everybody will go back, they'll talk about it, they'll talk in their family about it, everybody will do it for a few months. And then we start becoming complacent and we stop. So we need women to stay constantly vigilant about it. 8 out of the 10 lumps that you pick up will be benign. But for the fact that you miss the 2 or you ignore the 2 lumps that may be early cancers, we take the effort of diagnosing or evaluating all 10 lumps. Mammography is our best tool for early detection and for screening. There's a 30% reduction in the risk of death related to mammographic screening for women, especially over the age of 50. 25% of overdiagnosis may be associated with mammography, but a lot of it can be circumvented by adding in additional evaluations like an ultrasound if needed. A mammogram does not increase your risk of cancer. It does not cause radiation that harms you. It's done in a certain way with a certain amount of radiation that is beneficial to you. The only concern with a mammogram is dependent on the density of your breast. So how much white area or parenchyma there is in your breast, the mammogram may not be enough. If you go from A to D, you see that the amount of white area in your breast is increasing, which makes it more difficult for the radiologist to pick up small lesions. An example is this sky. You can see a lot of clouds in the sky, and the small moon that may or may not be in the sky is hidden. As the clouds disappear, so as your parenchyma reduces, we are able to pick up the small moon like is seen here. So this is the one peril of mammography, which is why you will hear of an additional ultrasound being asked for at some time. All of this is so that we do not miss small lesions. So the current guidelines are very clear. For women with average risk, that means you do not have family history which is significant, or you do not have a BRCA mutation yourself. The recommendations are to do a mammogram once in 2 years for women between the age of 40 to 74. An alternative could be a clinical breast examination. There is data to suggest that you'll pick it up small with a clinical breast examination. But what we do still push for is that a mammography, where available, is what our first step would be. Other methods like a USG and MRI are all just used as adjuncts to a mammogram. That means in addition to it. A thermoscan is something you may see a bus of roam around in the community. We can tell you that the evidence today is not strong enough. It actually creates more anxiety because it picks up areas that we cannot see on routine imaging, and we are unable to therefore treat. So the diagnosis of any lump in the breast would be a good clinical examination, a mammogram, and a biopsy. This is known as the triple test. This is what completes the evaluation and helps us move forward. The biggest stigma associated with breast cancer is the fear of losing the breast. And I can tell you that today, breast-conserving surgery, especially for early breast cancer, is the standard of care and the preferred treatment. It is extremely safe to undergo. There is safety with long-term follow-up, which tells us that breast-conserving surgery is probably better to do for our patients. Treatment of breast cancer, even early, requires multimodality approach. You will hear of the patient getting chemotherapy, radiation, surgery, hormone targeted. It sounds like a lot, but it is because we know we are moving towards better cure. The treatment isn't based just on a certain stage or subtype. It's based on multiple parameters, and that's why a whole team comes together to put it for you. You saw the image of the 7 of us. That's part of the team with it that's going to work together to treat a cancer. Few newer things that you will have heard of that have moved the way breast cancer treatments are done in today. One is the use of voltage-gated sodium, which is local anesthesia at the time of surgery. A simple intervention like that, where we add in local anesthesia, reduces the risk of disease coming back. In India, we work towards looking at what can improve our patients' outcome, doing what is minimal without financial burden, and this is one of those. So what beyond just routine breast-conserving surgery? And I show you this because there is a big change from how we started treatment for breast cancer to where we are today. From large removal of the breast right up to oncoplastic procedures. All of this is because today we are seeing benefit for patients in outcome. Patients are living longer because of the various treatments that we have available. They are doing well, and we're potentially able to cure breast cancer. So our focus has now moved towards quality of life and improving outcomes and having our patients live happily for longer. So the first of these is the step towards better cosmetic outcome for quality of life. Just saving the breast is not going to give her good outcome. We need to add in certain procedures to give you better mounds, to give better looking outcomes. Simple scars placed on the breast can also do that for us, as do certain oncoplastic procedures. But we can also hide the scar in certain situations around the nipple areolar complex. We do this for a lot of young girls with scars that would otherwise come in what we call the social crease. You don't want them to live in the fear that someone will be able to see the scar when they're wearing a shirt or a t-shirt. We also use a lot of flaps and perforator and pedicle flaps like the LD to recreate the breast or a small part of the breast. Something else we have done to give our patients better quality of life is the extent of axillary surgery. Axillary surgery is that you have to biopsy the lymph nodes that drain the breast lump. The lymph node has to be staged. If it's positive, we unfortunately do need to clear that, and there is a risk of arm swelling or lymphedema. If we are able to save that, we do a procedure known as sentinel node biopsy, where we're using guided dyes to be able to identify smaller number of nodes, excise only the small number of nodes, and offer our patients a better outcome. Some patients still need all the treatment. Like I showed you, we'll work together as a team. There will be chemoradiation involved. Some of our patients will need a mastectomy. Some of our patients will need axillary clearance. So we work towards improving quality of life even in those situations. And one of the biggest endeavors we've done towards that is increasing the use of yoga for patients while on treatment with breast cancer. We've done a study which tells us that there is an improved quality of life benefit while patients are taking treatment for cancer and on follow-up with the use of simple interventions like yoga. Most women feel a lot of fatigue while on chemotherapy and in follow-up, and yoga showed us the benefit of reducing that fatigue to almost zero. So today, with the Women's Cancer Prevention Clinic, our effort is not just to bring you in early, is to screen for lesions before they become palpable, and also be able to offer correct treatments and better quality of life to our patients. Thank you.
Thank you, ma'am. I would now like to invite Dr. Richa Bansal, Consultant Gynec-Oncology and Robotic Surgery. Dr. Bansal has been practicing in the field of gynecological oncology for the last 10 years with special interest in dealing with gynecological malignancies in young women. Dr. Bansal will be speaking on gynecological cancers and are you at risk?
So good afternoon, everyone. I'll be speaking majorly on gynecological cancers and how we can detect them early or prevent them. So gynecological cancers, which are cancer of the cervix, ovary, uterus, vagina, vulva, basically the female genital organs, they are a major public health problem in India. More than 50 to 60% of cancers which get diagnosed in women are either cancer of the breast or gynecological cancers. Apart from the high incidence in our women, another important aspect that has already been highlighted, but I will want to highlight it again, is that majority of the cancers that are being diagnosed in our women are already in the locally advanced or advanced stages at the time of diagnosis. So cancer which has been, be it cancer of any part of the body, if it gets diagnosed at an early stage, the treatment is likely to give us, there are higher chances of cure with the treatment, and the treatment protocols will be much simpler. Like for example, if we are diagnosing cervical cancer in stage 1, the treatment is just radical hysterectomy, appropriate lymph node dissection, and definitely we can aim for very high cure rates. But if say cervical cancer is diagnosed in stage 2 or stage 3, multiple treatment modalities will be required, that is radiation will be required, chemotherapy will be required, sometimes surgery may also be required, and even then we cannot guarantee very high cure rates. So this is the benefit of diagnosing cancer early, so that treatment can be completed without much complications and also expecting higher cure. And of course, lesser cost. The treatment cost will also be less. But unfortunately, majority of the cancers that we diagnose in India are already at the locally advanced and advanced stages. And partly the reasons that we can say are sometimes, lack of awareness of common signs and symptoms of cancers among women, lack of screening facilities, or lack of awareness about the need for screening. So I think we want to address this need through our cancer clinic, so that we can make women aware of the common symptoms and signs of common cancers, also make them aware of the common facilities, screening facilities that they must do, and also bringing these facilities in their access. So coming to cervical cancer first, after cancer breast, cervical cancer is the second most common cancer diagnosed in Indian women, and in fact in many rural areas and many states of India, cervical cancer still ranks as number 1 cancer, the most common cancer. And even International Agency of Research in Cancer and WHO have said that almost 85% of the cancers that get diagnosed globally are being diagnosed in middle and low income countries. In these countries, almost 9 in 10 women which die from cervical cancer are in low and middle income countries. 1 woman dies of cervical cancer every 2 minutes. And if we do not act now, the deaths from cervical cancer will rise by almost 50% by 2030. So what causes cervical cancer? Cervical cancer is caused by a virus, which is human papilloma virus, and it is actually the most common sexually transmitted infection that happens in humans. Like how we know liver cancer can be caused by hepatitis B and hepatitis C virus, similarly cervical cancer is caused by human papilloma virus, which is actually a sexually transmitted infection. Whenever a couple starts their sexual journey, almost 90% of them will get infected with this virus, which is called HPV. But majority of the women will be able to clear this virus from their genital tract spontaneously with the help of body's own immunity. It is only in those 5 to 10% of the women who are not able to clear this virus from the genital tract. It is majorly in those who will become at risk for cervical cancer. So he is a German physician, Harald zur Hausen, who discovered HPV virus, and hence he was awarded Nobel Prize in 2008. We also have devised now vaccines against this HPV virus. You all are aware about hepatitis B vaccine. It is now a part of national immunization schedule. So similarly, we do have vaccines for HPV, but the knowledge and awareness about these vaccines is actually, unfortunately, very less. So cervical cancer is the only preventable cancer or only preventable gynecological cancer. And actually very few cancers of the body are entirely preventable. Cervical cancer is one of them. And why do I say that cervical cancer is preventable? Because we have 2 very important tools that we can use to prevent this cervical cancer. One is HPV vaccine, which are Gardasil and Cervarix. So these vaccines prevent HPV infection. So these vaccines should be given. The most ideal age group is between 9 to 15 years, that is young girls. And if a girl has missed taking her vaccine up to 15 years of age, the next best time is that we can give her before she becomes sexually active or before her marriage. So that is the second best time that we can give her. HPV vaccines, the safety and efficacy in preventing cervical precancers and cancer has been proven beyond any doubt, and these are absolutely safe to be given. In fact, majority of the Western countries have been able to drastically lower their cervical cancer incidence with the help of these HPV vaccines. And majority of the developed countries have included these vaccines as a part of their national immunization program. So definitely I urge all of you all to, be aware of this HPV vaccine and also advise your patients, your family members. So every young girl should be given the benefit of this HPV vaccine. Another tool that we have is Pap smear screening and HPV testing. So Pap smear screening basically is, visualization of cervical epithelial cells in the cervical secretions. We collect the cervical secretions and we smear it on a slide and we visualize it under the microscope to see if there are any abnormalities in those cervical cells. So if there are any abnormalities, these can be picked up much more earlier, even before the development of any cervical precancer or cancer. Pap smear screening, like we have said before also, is advised between 30 to 65 years of age, every 3 years interval. So every married woman should be advised to take Pap smear screening. Another reason why I say that cervical cancer is preventable is because there is a long pre-invasive state. The biology of the disease is such that it gives us many opportunities to detect these cervical cell abnormalities and cervical precancer so that we can prevent the progression to cervical cancer. So the average age of a woman becoming sexually active or average age of marriage is usually late teens or early 20s. So we can assume that this is the time that a woman acquires HPV infection in her genital tract. And the average age of diagnosis of cervical cancer is usually late 30s or early 40s. So we have good 10 to 15 years between a woman contracting HPV virus and she actually developing cervical cancer because of this virus. So it gives us many opportunities to do Pap smear screening and detect any abnormal cervical changes much before she develops cervical cancer. And it has been actually scientifically proven that if a woman undergoes screening even once with the help of Pap smear and HPV test, even once in her lifetime between 35 to 55 years of age, we can drastically reduce the cervical cancer changes. So these are the vaccines which are available, Cervarix and Gardasil. We now also have our indigenous Indian vaccine, which is Cervavac, which is available at much lesser cost. So this is what I'm talking about, that when we combine vaccination in young girls and screening in married women, the impact that we can have on cervical cancer incidence reduction and reduction in the cervical cancer deaths can be much more higher. So this was the temporal relationship that I was talking about. The usual age of contracting the virus is usually late teens. The virus then multiplies in the genital tract and then slowly it causes abnormal changes in the cervix. So apart from this HPV virus, there are certain additional risk factors which increases the risk of a woman developing cervical cancer. And these are early onset of sexual activity. A girl becoming sexually active, even before 15 years of age. Early age at first childbirth. A lady becoming, delivering her first child less than 20 years of age. Multiple male sexual partners. If the partner has sexually transmitted disease, and tobacco, HIV and immunosuppression, and so on. So these are the women who are specially at risk for cervical cancer. But mind you, these are not the only women who develop cancer. Majority of the women who are walking in my clinic with the diagnosis of cervical cancer do not belong to one of these categories. They're absolutely normal women, just like that in society. So this was about prevention and early detection of cervical cancer, HPV vaccination and pap smear. These are the two things that we need to remember. Now coming to symptoms of cervical cancer, definitely again education about these symptoms will also go a long way in women not ignoring these symptoms, and we definitely want them to present early in our clinic if they experience one of these symptoms. So these are unusual vaginal discharge, and especially if it is foul smelling, vaginal bleeding after having sexual intercourse, any unusual vaginal bleeding or spotting in between periods, or vaginal bleeding after menopause. So any amount of bleeding after menopause, even if it is for 1 episode, 2 episodes, even if it is just spotting, is important and should not be ignored. Early cervical cancer, very early disease, may not give rise to any of these symptoms. And this can be picked up only if the woman has been screening herself with pap smear. So this highlights the importance of screening. Just in short about treatment of cervical cancer, again, like I said, treatment and survival of any cancer depends on the stage at which it gets diagnosed. Stage 1 cancer will be curable with surgery alone. More advanced stages will require radiation, chemotherapy, surgery, and still we cannot guarantee cure. So it is very important that cervical cancer is picked up early and also treated appropriately. Now, just a short about ovarian cancer. Ovarian cancer is the second most common gynecological cancer in Indian women, and we also call it the most deadly of all cancers, most deadly of all gynecological cancers. And this is because, ovaries lie in the abdomen, this abdominal cavity in our stomach, and abdominal cavity can accommodate, even if ovary enlarges. So there are hardly any symptoms that early ovarian cancer give rise to. And of course, CA125 test will also be normal in very early ovarian cancer. So by the time a lady presents with symptoms to a doctor, ovarian cancer can already be at an advanced stage. So nevertheless, we should still be aware of the common symptoms that should alert us and also the doctors about the possibility of ovarian cancer. And in fact, I would say that if a lady is experiencing any abnormal abdominal symptoms should not be ignored, and at least one ultrasound examination should definitely be done. And what are those symptoms that we need to be careful about? Feeling of abdominal bloating or abdominal swelling, feeling of a lump in the abdomen. Quickly feeling full after eating. Like previously, I was eating 3 chapatis, but since last 15 to 20 days, my appetite has decreased. And I even after eating 1 chapati, I'm feeling as if I'm absolutely full and I cannot eat anymore. Weight loss, discomfort in the pelvic area, some abdominal pain, changes in the bowel habits, like constipation or loose motions, or sometimes constipation alternating with loose motions. Frequent need to urinate. Before, the frequency of urination was every 2 to 3 hours. But since last 1 month or 3 weeks, the frequency is every 1 hour. So these are some of the symptoms that should alert us about possibility of an ovarian mass or ovarian malignancy. And what are the risk factors for ovarian cancer? Means who could be the women who are especially at higher risk for ovarian cancer? So one thing is older age. Ovarian cancer generally occurs in more advanced stages. So any ovarian cyst and ovarian mass being diagnosed in an elderly woman definitely will give us a higher level of suspicion as compared to any ovarian cyst being diagnosed at a younger age. If a woman already has inherited mutations, BRCA1, BRCA2, or women who are family members of women who have previously acquired ovarian or breast cancer, or who are known to be BRCA positive. Other factors being, early age at menarche, late menopause, having fewer number of kids, or having first child after 35 years of age. So these are the common risk factors for ovarian cancer as well as for uterine cancer. So like I said, any unusual abdominal symptom should not be ignored, and at least one ultrasound examination to look for the ovaries definitely must be advised. Because we know that this cancer is so deadly, we always want to err on the caution side rather than ignore symptoms. So even if my advising ultrasound will go, the report comes back as normal, but still I would suggest that at least one ultrasound should always be done in any lady coming to you with abnormal symptoms. If there is a suspicion based on ultrasound examination or CT examination that a particular ovarian cyst is looking malignant, or if the chances of it being malignancy are high, definitely she should be referred to a gynecological oncologist rather than a general gynac, because it has been scientifically proven that women who are treated by oncosurgeons will have much better survival as compared to women who are treated with general surgeons. Now coming to uterine cancer. So uterine cancer, when we were studying, we typically read that uterine cancer is a cancer of the West, and it is not so common in India. And also that uterine cancer usually occurs in older women after 55 or probably 60 years of age. But in last few years, we have been seeing a drastic change in this, meaning that we have been diagnosing uterine cancer at much earlier stages. I will not be surprised if I diagnose uterine cancer in a woman in her 30s, 40s, and also, the incidence is also rising, not just in young women, but overall the incidence is rising. And the factors for these are, one very important is obesity. Second important thing is PCOS. We all have heard about polycystic ovarian syndrome in young girls. So there are a lot of hormonal changes that occur in these young girls, and these girls tend to be obese. There is glucose intolerance. There are higher risk of getting diabetes. So the menstrual cycle in these young women with PCOS is such that the endometrial lining is constantly being exposed to estrogen without the protective effect of progesterone, and hence a girl who had history of PCOS early in her life definitely will have higher risk of uterine cancer if that PCOS has not been corrected, if that abnormal hormonal milieu which is there inside is not corrected. So most important reasons for rising incidence of uterine cancer in our country, especially in younger ages, are PCOS, obesity, diabetes, delaying childbirth. Majority of us are, being career oriented. Majority of the women are delaying their marriage. They're delaying their childbirth to beyond 35 years of age, having less number of children, not being able to breastfeed for at least 6 months. So all these factors, they sort of produce such hormonal disturbances in the body that the woman becomes at a higher risk for uterine cancer. Again, family history of any gynecological malignancy in the family definitely should not be ignored. So how can we prevent it? Effective treatment of PCOS, adopting a healthy lifestyle, weight control, physical activity, exercise. These are the measures which one should undertake to prevent the risk of many cancers, not just uterine, but also ovarian, but also breast, colon. Many cancers are, now we are believing that they are all lifestyle cancers, and better lifestyle will help us to prevent all those cancers. So uterine cancer, the most common symptom is vaginal bleeding. So again, I would say any abnormal bleeding. So if a lady, 40-year-old lady comes to me with the symptoms that before 6 months her periods were regular, her periods used to be every 28 days, 3 to 4 days cycle, not very heavy, but in last 6 months her periods are heavy, bleeding lasts for 5 to 6 days, she has to use multiple pads. So definitely I would not ignore, and I will not think that, oh, she's only 40 years and we do not need to investigate her for uterine cancer. So any abnormal, change or any unusual change in her menstrual period. Most importantly, any amount of postmenopausal bleeding. If a woman has attained menopause, any amount of spotting, any amount of bleeding, even if it was just one episode, is significant, should not be ignored, and should be investigated further. Treatment for uterine cancer, again, if it's early stage disease, it is very simple. It is curable. The disease is curable with just surgery alone. And if it is diagnosed in more advanced stages, then definitely she will have to undergo surgery, radiation, and so on. So for uterine cancer, we are offering robotic surgery. Robotic surgery has much less complications, and with proven oncological safety, patient is able to mobilize better. She can resume with her daily activities at much earlier time, and recovery period is much less. So this was a few points that I wanted to highlight about gynecological cancers. Most important cancer is cervical cancer. Most important thing that we need to remember is HPV vaccination in young girls, pap smear screening in married and older women. For ovarian cancer, yes, any abnormal abdominal symptoms should not be ignored, and at least one ultrasound examination should be done. Uterine cancer, any amount of bleeding, any unusual change in your menstrual pattern should not be ignored. And again, a lot of lifestyle measures, that watching over our weight, regular exercise, adopting healthy, dietary habits, all this would go a long way in preventing many cancers, not just ovarian, uterine, but also breast, colon, and so on, intestinal cancer basically. Thank you so much.
Thank you, Dr. Richa, for this enlightening talk. So, I think Dr. Richa के slide में एक मैं quote पढ़ रही थी कि women who are educated have much healthier families. तो आज हमारे पास दो ऐसे families आए हैं of women who were educated and who were aware, जो हमारे साथ आज उनका experience share करने वाले हैं. We have two patients with us who are going to talk about their experiences, and it is so interesting. While I was talking to these two very strong ladies, जब मैं इनसे बात कर रही थी तो उनकी बेटियां आई हैं उन्हें support करने के लिए, and it was very interesting to know that when we are talking about women power, तो कैसे बेटियां support में आ रही हैं, and through their mothers, through the education awareness that they must have gotten through their mothers during their entire period of treatment, they have become educated and aware, and how now I hope they will come forward for these kind of screening clinics. तो पहली मैं patient जिनको बुलाना चाहूँगी, ज्योति पांचाल. या ज्योति आपल्या मुली आणि आपल्या हस्बंड त्यांच्यासोबत आलेली आहे. आणि इट्स सो इंटरेस्टिंग. ज्योतीचा एक मुलगा आहे हू इज इन जॉर्डन, सध्या जॉर्डनमध्ये आहे कामाला, आणि खूपच चांगली एक बातमी ज्योतीने सांगितली. आय थिंक तुम्हीच सांगा. ज्योती.
नमस्कार सगळ्यांना. मी ज्योती दीपक पांचाळ. मी माझ्या मिस्टरांच्या बरोबर पण आले आणि मुलीच्या बरोबर पण आले. मला एवढंच सांगायचं आहे की डॉक्टर रिचा बन्सल आणि डॉक्टर तेजेंद्र सिंग यांनी खूप खूप त्यांचे पण धन्यवाद आहेत की त्यांना मला एवढं सपोर्ट केलं ना की काही होणार नाही आहे, व्यवस्थित व्हाल तुम्ही सगळं. आणि सगळ्यांच्याबद्दल म्हणजे त्यांनी इतकं छान सांगितलं ना की मला इतका आनंद वाटला की मी आता खूप हेल्दी आहे आणि मी माझी विल पॉवर पण हलवली नाही आहे आणि सगळ्या याच्यातून पण मी व्यवस्थित बरी झालेली आहे. आणि त्याच्याबद्दल डॉक्टर तेजेंद्र सिंग आणि रिचा बन्सल यांना खूप खूप धन्यवाद. आणि हां, माझ्या मुलीच्याबद्दल पण त्यांनी सांगितलं होतं की काही काळजी करू नका, व्यवस्थित होईल. माझ्या मुलीचं पण आता उद्या बोलणी होणार आहेत, त्यामुळे माझ्या मुलीचं पण उद्या लग्न ठरत आहे.
थँक्यू ज्योती, कंग्रॅच्युलेशन्स. आणि ज्योती आणि त्यांच्या फैमिलीला. अगली जो है स्ट्रॉन्ग लेडी जो है मैं जिनको बुलाना चाहूँगी, पुष्पा शर्मा. तो पुष्पा जी से मैंने जब बात की तो थोड़ा सा डरी हुई थी पुष्पा, बट आई थिंक आपको डरने की तो कोई ज़रूरत ही नहीं है, आप इतने स्ट्रांगली पूरे बीमारी का सामना करके निकली हैं. तो पुष्पा जी अगेन शी हैज़ कम विथ हर डॉटर, शी हैज़ 2 daughters. So let us see what Pushpa ji has to say. Let us hear what Pushpa ji has to say. Thank you.
मैं पुष्पा शर्मा खारघर में रहती हूँ. मेरे को जनवरी में ब्लीडिंग हुई थी. ब्लीडिंग के बाद मैंने सोनोग्राफी कराई तो सोनोग्राफी में मेरे को पॉलिप निकली. फिर पॉलिप का ऑपरेशन कराया तो उसमें कैंसर निकला. फिर मैडम का, ऋचा बंसल मैडम का किसी ने मेरे को बताया तो मैडम ने मेरे को रोबोटिक सर्जरी करी. आज मैं बिल्कुल फिट हूँ और है ना 2 महीने हो गए मेरे ऑपरेशन को और मैं सब काम करने लगी हूँ नॉर्मल. मैं मैडम को बहुत बहुत धन्यवाद देती हूँ.
Thank you, Jyoti, and thank you, Pushpa ji. So patient stories are always very, they're very encouraging. Even during our genetic counseling, when we offer genetic counseling for patients and their families, I think family dynamics are so important. So today they got, they came with both their daughters, and that was actually so much more fascinating for me to see that how strongly both of them are there with their mothers to give full support. And with this, I would like to invite Dr. Richa Bansal to please give a vote of thanks and conclude the program.
So heartfelt thanks to all of you all for attending, today's program. And deepest thanks to both my patients, Jyoti Panchal ji and Pushpa Sharma ji. Thank you so much. आपका बहुत बहुत धन्यवाद. आप मेरे invitation पे आप यहाँ पे आए, आपने इतना समय निकाला. And both the daughters, yes, they are very strong women. Daughters, they are so supportive of their mothers. And it is very important for us also to understand the basics of cancer and how we can prevent cancers in others. So I stand here today as a proud oncologist as we launch our Women's Cancer Prevention Clinic, and I would like to express my gratitude and thanks to all those who have made this possible. So I would like to start by thanking our management, who have always been very supportive of all our endeavors and all our initiatives, and also they always are so encouraging towards us. I would also like to extend my gratitude to all our senior oncologists who have been our guiding lights and imparting wisdom and knowledge to us. Their support has been instrumental in our growth and development. I would like to express my appreciation and thanks to all the guests who have taken time out, Sangeeta Srivastav ma'am, Dr. Dolly from State Bank of India, and all of you all for taking out time out of your busy schedules and being with us today. Finally, I would like to thank our marketing, our IT support, housekeeping, our cafeteria support for making this event a grand success. And your contributions have definitely not gone unnoticed, and I'm really grateful for all the efforts that every one of you all have put in. In conclusion, I would like to say that this event would definitely not have been possible without the support and hard work of each one of you all. And my sincere thanks to everybody. Thank you so much.
Thank you, Dr. Richa. So, just a few minutes, हम tea organize कर रहे हैं, and I would request everyone to please have tea and coffee and only then leave. Thank you all. Thank you.